I mentioned NAMI before, the National Alliance on Mental Illness, and they have a program here in Baltimore called Virtual Voices. And so I've been volunteering for this. And what it was developed by a woman. I'm not sure if I think maybe she did have schizophrenia. I'm not sure how it, I should know the history, but basically they go into police training academies, they go into high schools, they go into other educational schools, and they have it's an audio recording. It's 45 minutes of what it's like for someone who has auditory hallucinations. Mm. And what happens is, so for 45 minutes, they have to have this thing on and have it on the full volume. And during the 45-minute period, people go through different segments. One is like they're just filling out a test, like there's a comprehension, like they have to read an essay and answer questions while this stuff is still going on in their ears. And then there's like a psychiatrist interview. So I play like the psychiatrist, and they do a mini mental. So basically, asking your name, the date, the month, who's the president, can you count backwards from 100, again, while having this in their ear. And then another segment is where they just like go to an area like they're playing games. So they play checkers or Connect Four or whatever games with this in their ear. And I've listened to this audio for maybe 5 minutes, and I had to take it out because it was like, wow, because my mom had heard voices. After the encounter's over, we debrief everybody, what was it like for you, and how did you deal with it? And especially with police officers, because they're the first responders for an event, right? Something happens in the home, they get the phone call 911. For them to understand that this is what someone's going through, this is their suffering. And so I think it really helps develop empathy and this deeper understanding of what it's like to walk in someone's shoes who's dealing with a mental health crisis, because it's a crisis. Definitely. As opposed to like that weirdo or that, I'm really blown away by that. I knew my mother was, she had this thing, like she thought like police were coming. And I don't know if your mom had auditory. Did she have, like, do you think she heard voices? Yeah. And it's intense when you have this in your ears with this, simulation. If someone's yelling at you or telling you you're awful or like telling you to do something that you don't want to do. But she lived with that. And she would always yell, stop, stop. Like she was trying to stop it. Of course you'd want to stop it if that's something that's happening. I mean, I think we're in the place now where at least there's that education exists. And I think that's a really helpful tool for first responders or just basic human empathy.
Absolutely.
Like, it's a real disorder, a real brain disorder. And maybe you should not make fun of it, and, to give people some sense of kindness and empathy. Yeah. Right. Compassion.
And like you say, they're the first responders. And I remember when I was 9 and the police came, there was an ambulance and there were 3 police cars. When you're a little kid, it's so scary. And you think, okay, I've seen some things on television where somebody shoots somebody and then all these police cars come, but now they're coming for my mom. Yeah. And my mom, with the voices and everything, she reached over for the police officer's gun and they just slammed her to the floor. And she called for me. I ran into the room and she was like, she was cuffed and on the floor. And that's actually one of the most traumatic experiences that it's still very hard to talk about. But I think it's important what you're saying. I didn't know about this kind of training because, for these people, it's, they're called to a scene, don't know much about what's going on. But if they were to have that extra insight to a mentally ill patient's kind of what's going on in their mind, what kind of a situation they live through day to day, and how it affects a home, maybe the approach would be a little more humane. They had to do that because at that point they were at risk in case my mum pulled out the gun. But it's so difficult because in that moment they're like, okay, we've got to extract this woman from her home, but that woman is your mom.
Right. And for you as a child to observe that in a child's mindset, you are 50% of each parent, right? So if one parent is is in jail or in a psychiatric hospital or is manifesting these behaviors that are so disturbing, like you think like that's part of me, you think that's part of you, or maybe you're the cause of it. And it's very confusing. And I'm sorry you had to see that. I mean, that's why I would run. And when I knew if the police were coming, and a few times that that I did observe, it was just like this terror. It's terrifying. It's really terrifying. So I don't like like I can't watch a lot of shows. I don't like watching crime. Not that there was crime in my home, but it was overwhelming. I would hide and, sing songs or tell make up stories just to try to like block out that that's happening.